The physiology of the renal system, the micturition reflex. Micturition is a less often used but proper term for urination or voiding. It results from an interplay of voluntary and involuntary actions by the internal and external urethra sphincters. When bladder volume reaches about 150 milliliters, an urge to void is sensed but is easily overridden. Voluntary control of urination relies on consciously preventing relaxation of the external urethra sphincter to maintain urinary continence. As the bladder fills, subsequent urges become harder to ignore. Ultimately, voluntary constraint fails with resulting incontinence, which will occur as bladder volume approaches 300 to 400 milliliters. Normal micturition is a result of stretch receptors in the bladder wall that transmit nerve impulses to the sacral region of the spinal cord to generate a spinal reflex. The resulting parasympathetic neural outflow causes contraction of the detrusor muscle and relaxation of the involuntary internal urethral sphincter. At the same time, the spinal cord inhibits somatic motor neurons, resulting in the relaxation of the skeletal muscle of the external urethra sphincter. The micturition reflex is active in infants, but with maturity, children learn to override the reflex by asserting external sphincter control, thereby delaying voiding, also known as potty training. This reflex may be preserved even in the face of spinal cord injury that results in paraplegia or quadriplegia. However, relaxation of the external sphincter may not be possible in all cases, and therefore, periodic catheterization may be necessary for bladder emptying. Nerves involved in the control of urination include the hypogastric, pelvic, and pudendal. Voluntary micturition requires an intact spinal cord and functional pudendal nerve arising from the sacral micturition center. Since the external urinary sphincter is voluntary skeletal muscle, actions by cholinergic neurons maintain contraction and thereby continence during filling of the bladder. At the same time, sympathetic nervous activity via the hypogastric nerves suppress contraction of the detrusor muscle. With further bladder stretch, afferent signals traveling over sacral pelvic nerves activate parasympathetic neurons. This activates efferent neurons to release acetylcholine at the neuromuscular junctions, producing detrusor contraction and bladder emptying. The physiology or function of the urinary system. The functions include to remove waste products and medicines from the body, to balance the body's fluids, to balance a variety of electrolytes, release hormones to control blood pressure, release a hormone to control red blood cell production, help with bone health by controlling calcium and phosphorus. Different parts of the nephron use specific processes to produce urine, filtration, reabsorption, and secretion. The goal is to modify the composition of the plasma and, in doing so, produce the waste product urine. The nephrons of the kidney are the functional unit. Nephrons take a simple filtrate of the blood and modify it into urine. Many changes take place in the different parts of the nephron before urine is created for disposal. The term forming urine will be used hereafter to describe the filtrate as it is modified into true urine. The principal task of the nephron population is to balance the plasma to homeostatic set points and excrete potential toxins in the urine. They do this by accomplishing three principal functions: filtration, reabsorption, and secretion. They also have additional secondary functions that exert control in three areas: blood pressure via the production of renin, red blood cell production via the hormone EPO, and calcium absorption via the conversion of calcidiol into calcitriol, the active form of vitamin D. The loop of Henle. The descending and ascending portions of the loop of Henle, sometimes referred to as the nephron loop, are, of course, just continuations of the same tubule. They run adjacent and parallel to each other after having made a hairpin turn in the deepest point of their descent. The descending loop of Henle consists of an initial short, thick portion and long, thin portion, whereas the ascending loop consists of an initial short, thin portion followed by a long, thick portion. The descending and ascending thin portions consist of simple squamous epithelium. Different portions of the loop have different permeabilities for solutes and water. Collecting ducts. The collecting ducts are continuous with the nephron, but are not technically part of it. In fact, each duct collects filtrate from several nephrons for final modification. Collecting ducts merge as they descend deeper into the medulla to form about 30 terminal ducts, which empty at a papilla. The glomerular filtration rate, or GFR. The volume of filtrate formed by kidneys per minute is termed the glomerular filtration rate. The heart pumps about 5 liters of blood per minute under resting conditions. Approximately 20% or 1 liter enters the kidneys to be filtered. On average, this liter results in the production of about 125 mils per minute filtrate produced in men and 105 mils per minute filtrate produced in women. This amount equates to a volume of about 180 liters per day, milliliters per day in men, and 150 mils per day in women. 99% of this filtrate is returned to the circulation by reabsorption, so that only about 1 to 2 liters of urine are produced per day. GFR is influenced by the hydrostatic pressure and colloid osmotic pressure on either side of the capillary membrane of the glomerulus. Recall that filtration occurs as pressure forces fluid and solutes through a semi-permeable barrier with the solute movement constrained by particle size. Hydrostatic pressure is the pressure produced by a fluid against a surface. If you have fluid on both sides of a barrier, both fluids exert pressure in opposing directions. The net fluid movement will be in the direction of the lower pressure. Osmosis is the movement of solvent or water across a membrane that is impermeable to a solute in the solution. This creates osmotic pressure, which will exist until the solute concentration is the same on both sides of a semi-permeable membrane. As long as the concentration differs, water will move. Glomerular filtration occurs when glomerular hydrostatic pressure exceeds the luminal hydrostatic pressure of Bowman's capsule. There is also an opposing force, the osmotic pressure, which is typically higher in the glomerular capillary. To understand why this is so, look more closely at the microenvironment on either side of the filtration membrane. You will find osmotic pressure exerted by the solutes inside the lumen of the capillary as well as inside the Bowman's capsule. Since the filtration membrane limits the size of particles crossing the membrane, the osmotic pressure inside the glomerular capillary is higher than the osmotic pressure in Bowman's capsule. Recall that cells and the medium to large proteins cannot pass between the podocyte processes or through the fenestrations of the capillary endothelial cells. This means that red and white blood cells, platelets, albumins, and other proteins too large to pass through the filter remain in the capillary, creating an average colloid osmotic pressure of 30 milligrams per mercury within the capillary. The absence of proteins in Bowman's space, or the lumen within Bowman's capsule, results in an osmotic pressure near zero. Thus, the only pressure moving fluid across the capillary wall into the lumen of Bowman's space is hydrostatic pressure. Hydrostatic fluid pressure is sufficient to push water through the membrane despite the osmotic pressure working against it. The sum of all the influences, both osmotic and hydrostatic, results in a net filtration pressure, or NFP, of about 10 millimeters per mercury. A proper concentration of solutes in the blood is important in maintaining osmotic pressure, both in the glomerulus and systemically.